I'm Ras. I'm the CEO of Ingenious Knowledge, a company that is using technology to advance education. And with me here is Nadin.
Hello, I'm Nadin Dütthorn. I'm a professor in nursing education at the University of Applied Science in Münster in Germany. And both we are involved in a project which is called ViReTrain. ViReTrain stands for Virtual Reality Training for Healthcare Professionals.
In this project, we are actually building very interesting solutions to use VR for training nurses. And I wanted to ask Nadin today a little more about the educational concept that is behind this project. Nadin, what is so special about the educational concept, and can you explain some of the key points a little more?
Yeah, our approach is a scenario-based approach. So as nursing really is an area where you work in a complex situative field, we try to bring the practice, the nursing practice, into the educational learning process. So we use scenarios which are authentic, which are complex, and which apply a multi-perspective perspectives on the scenarios. So
wow, I mean, that sounds like a lot of things. Let's ask you a little more about the details. You said the keyword authentic there. How do you think VR can help make a scenario more authentic?
Yeah, so our scenarios, they are based on reports from practice. So we try to include complexity by using real patients with a real name, with real issues, with real emotions. And we put these emotions into the scenario to understand the person as a real person.
Is that a challenge when you think of the development? Do you have to rethink the way of approaching such a scenario when it comes to developing something like that in a virtual reality setting as opposed to the more traditional setting?
Yeah, of course, because in the virtual reality you have to think before you really design a scenario. All the dialogues, they have to be authentic, they have to be drawn on real patients' narratives. But yet, we cannot really anticipate all the narratives before we play it. So that's really the kind of educational issue we have in that special project.
What do you think will be the big advantage when using VR, especially when you think of the learners? How do they benefit from something like that?
I think the learners can benefit because, in first place, you set up the VR classes, you get them on, and eventually you are in a nursing setting. So you're not in school anymore, but you are in a real patient room, and you look at the patient, and he looks very authentic, very close to a real patient, and you have to act. And things are coming, like as you are acting like at post-operative care, someone is coming into a room and is interrupting you, saying like, oh, excuse me, I really need something like the blood pressure or whatever, the thermometer, can I use it? And you're interrupted, but still you have to remember what was going on. So we can put the complexity into the VR learning setting, and the student really has to handle within the setting and has to go along the learning process while he's in a kind of authentic environment.
All right, thank you very much. I think this is very exciting, and I hope we'll see more of this in the future.